And then we got contacted by Dragon's Den. They liked the idea that the doctor's making food supplements, and then we got invited onto the show. BBC contacted us. They wanted to know all the due diligence, all the numbers, the projections, etc., etc. And we passed that stage, and then went to an audition. The biggest killer of men under 45 is suicide. The biggest killer, and 75% of all suicides are men. 75, that's 3/4 of all suicides are men, and it's particularly 40 to 50-year-old men who have grown up now. They're working, their kids have grown up essentially, and they're getting this midlife crisis. And we call it in medicine, an existential crisis. So the midlife crisis is quite a big part of self-diagnosis, is to take a step back and say, what's my normal? Am I sleeping more or less than normal? Am I socializing more or less than normal? It's all about your norm, because your normal could be 7 hours of sleep a day. But if you're going from 7 to 4, for you that's abnormal, so you've dropped your sleep. What's the reason for that? And there's campaigns out there. There's Calm, campaign against living miserably. There's Movember, which is obviously prostate cancer, but now it's gone into mental health as well, getting a lot of funding. Prince William's doing a lot of stuff around men's mental health. I think Prince Harry did some as well before he went to the States. So there is getting more traction. There are big people now.
What's going on, people? Welcome to the 6th episode of the Minted Minds podcast. We're here with Dr. Asif Munaf. Is that
That's right?
Right, yeah. Who is a doctor and a mental health advocate. Thank you for your time, and how are we today?
Thank you for having me. I'm good, thank you. Just finished work.
Yeah.
How are you?
Alhamdulillah. We're in Stoke at the moment, so it's a little drive, but we got here.
Nice weather at least.
Yeah, the weather's actually been better than I thought. It looks kind of deceiving, to be fair.
Yeah.
It's quite sunny and bright, but as soon as you
cold.
step outside, it's quite...
Yeah. It's 10 degrees, yeah.
So the main sort of thing that I want to discuss with you today is mental health.
Mm-hmm.
We all know that mental health is a big topic. But before we dive into mental health, I just want to talk about your experience in Dragon's Den. Now, I don't know if a lot of people... how did that come about? So I know you went on to Dragon's Den. How was that whole experience?
Right. Okay. So it's not really. It's not related to my job as a doctor. So a lot of people think, you went on Dragon's Den. Was that medical? It wasn't medical. It was. If you've seen the episode, it was to do with nutrition. And I've always been interested, coming from a personal training background. I've been interested in performance enhancement through non-steroids. So using nutrition, protein supplements, that kind of stuff. So
Okay.
The smoothie idea came about because of that. So I was working long shift as a doctor. I wasn't getting the necessary nutrition from the canteens. They were just pies and fish and chips, especially in Stoke,
Yeah.
So I kind of devised my own, alongside my wife, we devised our own recipe for batch production of smoothies. Then I took them to work with me. They became popular with, different doctors and nurses who tried them. And then I thought, let's try selling them. And then we got contacted by Dragon's Den. They liked the idea that the doctor's making food supplements, and then we got invited onto the show. BBC contacted us. They wanted to know all the due diligence, all the numbers, the projections, etc., etc. And we passed that stage, and then went to an audition in Manchester, Media City, and then we auditioned. The producers liked the product, and then the dragons, we pitched in front of them. Scary experience, but then we got shown as well, because a lot of people pitch, they don't always get shown on the program. They don't make the cut.
Okay. So the fact that you made it on TV shows that it was a good episode.
Yeah, good episode, and I think it was a shame that they didn't get the idea or like the product. They kind of saw it as too much of a risk. But for me, it was a great experience going on there.
I don't know if it was. So it's a similar program to Shark Tank.
That's right. Yeah.
Now. So someone pitched on Shark Tank. Do you know Ring?
Oh, the Ring Bell.
The Ring Bell. So I think they also... I don't know if it was Dragon's Den or Shark Tank. I know
it was Shark Tank in America. That's right.
They all kind of put the guy down and said, you're not going to do it. And now look at it.
$500 million, isn't it? Because I think Nas invested in that as well, Nas.
Okay.
So I think he put down 4 or 5 million. That's the rapper. And then within 5 years, he got 45 million back, so a tenfold increase in what he put down.
Yeah, because he's got acquired by Amazon now.
That's right. Yeah. So I think when they got acquired, their valuation was, you're looking at, I think it was $500 million or something. It was, big company. Yeah.
But look, if he would have listened to what they were saying, it's not going to go anywhere, then look where he is today.
Yeah, absolutely. I think another example of that is Brewdog. They're a brewing company in England. that make alcoholic beverages, and they went to Dragon's Den as well, and you know they're absolutely minted now. But I don't they came on the program, but I don't think they made the cut for the actual episodes.
Oh right, okay.
So they came a couple of years before me, and you know 2012 I think it was they went on, but they didn't get shown. And look at them now, you know they're doing lots of cold beers and you know
they're doing
they smashed, aren't they?
So you know your product, it was like a date smoothie.
That's right.
So was this something that you've always wanted to do? Like, did you plan on making it into a business, or was it just organically happened that way?
It kind of organically happened because, you know, with Ramadan coming in a few weeks, I'm not sure when this podcast goes out, but it'll
be probably in about a week's time. So hopefully, it'll be before Ramadan.
It's still Ramadan, just before then. So the smoothies were the traditional Asian or Muslim, you know, Arabic kind of sehri meal, isn't it? You have it in the morning, the pre-meal meal. It was dates and yogurt.
Yeah, it's the first thing that we have.
Yeah, exactly. But even when you have your your morning meal before you start the fast, for me it was dates and yogurt or dates and oats, and I'd mix them together, make like a little porridge, and then we got a big blender, you know, started making them, and then I thought, well, once Ramadan's over, let's try this actually for breakfast. And then, you know, a lot of my colleagues had never had dates before. They've certainly never had a date smoothie, especially when it's you know, full of oats and flax seeds and different kind of nuts in there. So it was quite novel for them. For me it was quite filling and nutritious.
There's a lot of benefits that come with dates,
That's
isn't
right,
there?
yes.
Like, I wasn't really a fan of dates, I'm not going to be honest with you. When we was young, like, we never used to...
I bet you got the cheap ones, didn't you? For like...
Or the chocolate-covered ones.
You've got to get good ones. The trick with dates is you've got to get mint jewel dates, which we use. They're like caramel. They're so juicy.
Yeah, because you can get different ones. You can get like fat, juicy ones, or you can get really small hard,
ones,
solid ones.
I bet you, like, typical Asian households, we all got them stock ones.
Yeah.
Man. They break your teeth.
Literally.
So me and my wife, like, we made sure we got the best dates, and then if you get good dates, there's no need to add sugar to the smoothies. You just use 1 or 2 dates.
Yeah, because you're saying it acts like a sweetener.
Yeah, absolutely. So it's like a sweetener, and it gives it that caramel complexion as well. So a nice colour, nice texture, because it's, you know, dates are like caramel. The good dates are like caramel, and then it gives it that sweetness as well. And for me, that was perfect. So it was like having liquid sweet porridge. Kept me going for hours and hours, and it tasted nice. We added different nuts to it, like pecan and walnut and pistachio. And then all the doctors that I worked with, they really enjoyed it. And so, you know, it just took off from there. So going back to your question, it was organic. We never thought we'd be on Dragon's Den. I never thought, you know, we'd have a business. It was all kind of grew from bringing it with me to lunch, people liking the product, and then selling it to doctors, and then selling it at the markets, and then it just kind of grew from there.
No, because it's definitely a mad experience, because, you know, you're on TV, you're preaching in front of people. If you could do anything different going back and looking back, is there anything that you'd do differently?
I think I'd have a bit more traction before I went on there.
I'd
actually approach the big retailers, the Holland and Barrett's, the Pretz, you know, all these kind of chains that do healthy-ish food. I'd approach them. I'd, you know, speak to restaurants, etc. Speak to vegan cafes if they want to stock it, and then get some traction. One of the biggest criticisms I got on the show was it's too early. You know, it's too risky for them.
I think from an investor's perspective, they want to see some sort of like you said, traction.
Yeah, exactly.
Because it gives them that little bit of confidence. Because obviously, you know, us as businessmen, as entrepreneurs, we had the vision. And I remember you were saying, like, you know, you could see the potential, which is why you valued it at whatever the value was at that time. I think a part of me feels as if they only do these things because they know it's going to make good television as well.
That's right, yeah.
Do you know what I mean? Like, a lot of it, like, whether they invest or whether they don't, a lot of it, they know if they be harsh or if they say certain things, it's good TV at the end of the day.
That's right, yeah. You know, if they put you down quickly, then it makes good TV.
Yeah, exactly.
If you had a smooth pitch, it doesn't always show, you know. So that's why probably a lot of the guys that have been on there who've not been on TV is because their pitch, they might not have gotten the investment, but the pitch was just kind of smooth pitch.
Just nothing to show.
Yeah, exactly. Without any hiccups. And, you know, any of the main terrestrial TV broadcasters like drama. They like, they like to answer back.
Us as humans, we like to see someone, you know, sort of getting grilled, or if someone's getting, you know, like an amazing pitch, well done, or you know, if investors are fighting over the person.
That's right.
So no,
kind of like a bit of drama.
No, thank you for sharing that anyway. But let's get into it. So again, the main sort of topic I want to cover is mental health. From me, mental health is definitely a big thing. It plays a big part in my life anyway. But let's just go, from the beginning. Like, what is mental health? How would you explain it to someone that probably doesn't really understand when people talk about mental health?
Yeah. So a good question to begin with. So mental health is all your attributes, your behaviors, your thought patterns that govern how your mind functions. So that's quite a complex definition, but essentially it's how balanced your mind is with all the chemicals that bathe the mind, all the transmitters that get fired from the brain. How are you on the scale, mood scale? How are you on the confidence scale? How are you sleeping? How are you interacting? So essentially it's your inward interaction with yourself and your outward interaction with yourself as well. So it's we know with depression you get withdrawn, you start ruminating, so that's more inward.
Okay.
So it's inward dysfunction. Psychosis is more of outward dysfunction, psychosis or mania. So you've got inward and outward. So it's essentially how you interact with yourself,
and how you interact with
other people essentially. So how you understand yourself, your behaviors, your thought patterns, your sleeping, eating, and general day-to-day activities, and how you come across other people as well in terms of social interactions, relationships, friendships.
Because I remember when I first come across the word mental health or the phrase mental health, we automatically assume, when I was younger, I automatically assumed like when you refer to the word mental, it puts this picture of like this mental, maniac or and then obviously as I grew older I kind of understood a little bit better. So when I think about mental health, I think about the two main sort of the most common forms of mental health sort of is anxiety and depression.
That's right,
So we all know we all have a form of mental health. We all have to look after our mental health.
Yeah.
How is one meant to sort of acknowledge if something is not going right? Because from what I've looked onto on the internet, people talking about depression, a lot of the times they say like, looking back, I realized I had depression, but at the time they didn't realize. So how are we meant to acknowledge that I'm going through depression or I'm suffering from anxiety or things like that?
So quite a big part of self-diagnosis is to take a step back and say, what's my normal? Am I sleeping more or less than normal? Am I socializing more or less than normal? It's all about your norm, because your normal could be 7 hours of sleep a day. But if you're going from 7 to 4, for you that's abnormal, so you've dropped your sleep. What's the reason for that? And then it's actually speaking to the people, your partner, your wife, your parents. How have I been over the last 3 months? Have I been more talkative, less talkative? How, what do you see in me? And that's why sometimes we have that bias. It's called cognitive clouding.
Okay.
Your eyesight, your vision, your kind of mind's eye, your introspection gets clouded, because you wouldn't necessarily know that you're sleeping more, eating more, etc. So it's good to ask other people, how have I been? Am I dressing like I used to? Am I on time for work? Am I more lazy? Am I getting sluggish? Am I forgetting things? Has my memory been? All these things point, if they're going abnormal, all these things point to something going on in the background.
So for instance, if my brother, he sleeps a lot. So if he's sleeping more or less than usual, is that like a sign of something's not right? Maybe a signal. Or...
Yeah, it could be. Yeah, so it depends on what their norm is. If their norm is to go sleep late at night and wake up late in the morning, then that's normal for them. Okay. But if there's a sudden disruption to their sleeping pattern, there's a sudden disruption to their eating, there's a sudden disruption to their activities, if they're more withdrawn now, if your brother used to come down at 7 p.m. to have dinner, now he doesn't come down, you've got to call him down. When he comes down, he's a bit more disheveled, he's a bit, he looks a bit more grumpy. There's something might be going on there. It's always worth asking your family or friends how the other person's doing, because like I say, we get that cognitive clouding where we wouldn't necessarily know how we're feeling ourselves. So it's always good to get that yardstick, ask someone else, how have you found me? And also have a very low threshold. We always say as doctors, are you happy, horny, hungry? Is that
the thing?
Yeah, it's the thing. Yeah.
Are you happy, horny, and hungry?
Yeah, it's kind of three things.
So those are things that we need to sort of.
Because in depression, one of the first things that goes is the appetite. Appetite really goes. Your libido goes.
Well, in depression, appetite goes.
The appetite goes, yeah. So
I've always thought that appetite sort of increases.
No. So you get comfort eating initially, but long depression, you stop eating. You really do. So initially, if you had a breakup or something, you've had you lost your job, you start eating more. Because you're anxious. You're initially you got this shock to your system, so you eat more to kind of distract yourself The chronic depression, people lose weight because they stop eating, they stop sleeping properly, they have less interaction with other people as well. So things that you normally find enjoyment in start kind of going by the wayside.
I always find depression a bit tricky because, you know, like people throw around the word, I'm depressed, but really you're just sad.
Yeah.
So, you know, if someone's feeling sad, like for instance, like a breakup, for instance, of course you're going to be feeling sad or whatever. When does it go into depression? Like how would you identify, okay, am I feeling sad or am I actually depressed where I need to kind of sort of look into it a little bit more? Or...
Yeah. So if you had a breakup, a job loss, someone in your family has died, etc., or you witness something horrific like COVID or a car crash, you know, that can, you know, bring about low mood, can bring about PTSD, anxiety, you know, traumatic experiences. If that lasts, I would say for more than 3 months, that's abnormal. So my cutoff as a doctor is like 3 months.
Oh, 3 months, okay.
I would say kind of, if you've broken up with someone and you're still crying every night, or you're still overeating, because you know the acute phase is overeating, then it gets chronic, then you stop eating. So you're still overeating, you're still, you know, in your room all the time, you stop doing a lot of things, you've stopped taking pleasure in your daily activities over a 3 month period. I think that's a good cutoff, because someone can lose their parent, you know, which is a very difficult thing for most people to do, and you can't say to that person they're depressed after 2 months if they're still upset, because that's a big part of their life. Or
of
it's
course.
Even worse than losing a parent is losing a child.
So it's kind of relative to what's happened.
Exactly, yeah. So bereavement, you know, you can get delayed bereavement, kind of grief reaction. So
yeah, because you know, some people might, you know, someone close to them might pass away.
Yeah.
You know, I've seen people kind of taking it well.
Yeah.
But then later on down the line, it's kind of caught up to them.
Yeah.
And they say, you know, haven't been able to sort of grieve properly.
Yeah, that's true. Yeah, especially in COVID now, people have lost their relatives.
Yeah.
And they have to do things quickly. They've had to do a quick, you know, funeral.
Yeah.
And they've had to go to the graveyard or cemetery or crematorium very quickly. And they've had to just, you know, get things overdone because, you know, COVID, and you can't invite people to the funeral. And then they grieve later. So we call it DABDA, which is like a mnemonic. So first, denial. So someone dies, you deny, like, oh, are you sure that's my parent? Are you sure that's my friend? It's called. So you first deny it. You know, if you read your WhatsApp messages that someone's died, you kind of you reread it. So you're kind of in shock. And then the second one is anger. So DA. So the second one is anger. So you get angry. Why is it this person's died and not this person? Or, you know, why is it this person? You know, why him or why her? So you get anger, you know, whether that's anger at God or anger at yourself, or anger at them, or anger at, you know, nature or whatever. You kind of get angry. Some people, as a doctor, get angry at me. They get angry at the staff, you know. Why is my father or my mother died? So denial, then anger, and then the second one is bereavement. You know, you kind of you start grieving for a bit. So after the anger, you start grieving a bit, and then the fourth stage, which you said is depression, is DABD. So the depression. So after you've bereaved, you've cried, you've let it out, you've enjoyed their memories, you've kind of, you know, done a prayer for them if you're religious.
Okay.
You know, that's the third stage, and then the fourth stage is the depression. That can last for, you know, 6 months, 1 year, 2 years, and that's when it's abnormal. So the depression stage of grieving, it can last for a few months, and that's when you might need to get, you know, bereavement counselling. We've had to do a lot of that in COVID because you know, a lot of people have died suddenly. We've had young people dying as well, so we've had a lot of counsellors helping relatives do bereavement counselling. And the fifth stage, so DABDA, the A, is acceptance. So you accept it. That person's not there anymore. So you start off with denial and you end up with acceptance. So it's a full circle, really. That can take 2 years. It can take a couple of weeks. And like I say, you know, some people accept it within a couple of days. So it all depends on you. If you've got an elderly grandmother who has had cancer for a few months, you kind of come around to it. You kind of mentally prepare yourself, isn't it? Yeah. But you know, nothing prepares you. Even as a doctor, when I see a parent lose a child in a road traffic accident, you know, how can you even prepare as a doctor to actually give them that bad news? You can't do that because if you think about your own kids. Yeah, so it's a big responsibility from a doctor's perspective. Yeah, absolutely. Isn't it? Yeah, and you get that. The more news you give to someone, your own kind of compassion kind of dwindles away. You know, for you, then it becomes a job. Do you get trained like to kind of how to deal with these certain sort of situations where you have to tell bad news to like? Because there's never there's no nice way about doing it, is there? You do, yeah. So we get like advanced communication techniques, how we speak. It's called breaking bad news. So you take, these techniques, you give them a warning, you accompany them, you give them tissue boxes, you give them tea and put them into a side room, relative. So we get trained in that. You get down to their level, you give your bleep away so you don't get disturbed. So all these kind of little nuances that you do.
Yeah.
So it's cool because that's advanced kind of techniques that you do. So we do get trained in it, but constantly breaking bad news does affect your mental health, and doctors and nurses have a lot of burnout and stress from this.
Because it kind of wears down on you at one point. I can
Absolutely.
imagine if you're telling people this bad news, or during the day, it's going to get to you.
Yeah, absolutely.
I think it's big up all the doctors out there. You're doing an amazing job, especially like you said during the whole pandemic. Mental health has kind of skyrocketed, hasn't it?
Yeah.
Do you feel as if we are talking about it as much as we need to, and do you feel as if, because it's not as if you're walking into a hospital and you've got a broken leg, we can identify what the problem is straight away and we can sort of fix it, whereas mental health is more of a complex thing, isn't it? Like, do you feel as if we need to do more in that regard? Do we need to do more research? Do we need to sort of put more funding behind it? I just want to get your opinion on that.
Yeah, so absolutely, we need to do more, and we are doing a bit more. There's been documentaries, this podcast that you're doing, and more people are speaking about it now openly, particularly ethnic minority mental health, BAME, and male mental health.
Yeah, I wanted to pick up on that because
I
know on your website you said mental health in men.
That's right, because for me that is so, under talked about. It's so underrepresented. Men are almost kind of, I think, 3 times more likely to commit suicide.
Men are, yeah.
But women are, if you look at suicide attempts, women outnumber men. Suicide attempts, it's like 60% to 40%. But when it comes to suicide actually being committed, men are 3 times more likely. So 1 woman to 3 men.
That's mad.
To actually commit. Successfully commit suicide. The biggest killer of men under 45 is suicide. The biggest killer. And 75% of all suicides are men. 75, that's 3/4 of all suicides are men.
Wow.
And it's particularly 40 to 50-year-old men who have grown up now, they're working, their kids have grown up essentially, and they're getting this midlife crisis. And we call it, in medicine, an existential crisis. So, the midlife crisis is like a term that everyone uses.
Midlife, you're going through a midlife crisis.
Exactly. You bought a new motorbike.
Well, you brought just a random car for no reason.
I was going to say, you're just going through a midlife crisis on the podcast, but you're way too young for that. You're way too young. It's like 45, 50. You buy a bike or whatever, But for men, why do they do that? Because a lot of men are losing a sense of purpose. Their kids are grown up now. Kids don't need them anymore. Perhaps their role as a provider's gone now. Their wife might be working as well, so their role as a sole breadwinner, because the wife's finished maternity leave, she's back to work now. So that kind of role as a provider, alpha male, has gone. So they're in this limbo state.
Got nothing to live for. I don't know what to do with my life.
Exactly. So and that study, there was a study done saying Irish men are much more likely to commit suicide than any other European men. Irish men, and they're the men that tend to be the most kind of traditional, like they work and women don't work, and they say, and that's a hidden kind of.
Is that because there's like a pressure on men?
Yeah.
So for Irish men, they're the providers.
Yeah.
So is that like because they've got this pressure where they need to provide, and if they're not able to do so, to provide a comfortable living for the family, I can imagine that playing a big part.
Yeah, absolutely.
In their mental health.
So you feel like you're a failure, if you can't provide. This whole social construct we have that men should provide, women should look after kids. That's the whole, it has been the norm for centuries.
Yeah, of course.
And now with more women taking up work, men's role as a sole provider has kind of dwindled by the wayside.
Is that a good thing then?
I think workplace equality is definitely good, 100%. Because
traditionally, coming from an Asian culture, again, the male provides, as you said, and the female, she's a stay-at-home mom, and again that pressure building up. I need to provide. So that's always been sort of the norm sort of thing. But I think we are coming out of that.
Yeah, because it puts a lot of pressure on the man. Imagine if he's lost his job in the lockdown, he's been furloughed. Because if his sense of identity is tied up solely in his ability to provide, then imagine when that job goes. Bang, he's he's not a man anymore according to his definitions of manhood. Do you understand? So men go through this what we call existential crisis, where they no longer feel wanted. They no longer feel needed. because the only need that they served in their families was the ability to put bread on the table. Now, once that's gone, the only logical option, because men tend to be more logical, their brain's telling you the only option you have now to end this suffering is suicide. The only option. That's why, we're looking at 3 times higher rates. The biggest killer of men under 45, it's not cancer, it's not diabetes, it's not asthma, it's suicide. There was a good program about 4 weeks ago on the BBC, you might have seen it, Roman Kemp, Martin Kemp's son, the EastEnders actor.
Yeah.
And he talked about how his best friend committed suicide, how men can just, even when men are about to commit suicide, they, they have that, I'm not weak, I'm smiling, I'm very healthy, and the next day they've committed suicide. So men have that battlefield mentality where they can't show any
weakness.
Yeah, any kink in their armor, no weakness at all. You've got to always be stoic. But deep down you could be depressed, you could be melting away inside. Whereas women talk more, they will talk to their females, they will, because if you look at women's psychology, it's always about feel, that made me feel like this, I feel like that, when you did that made me feel like this. Whereas mine is more action based, and suicide is an action. Suicide is an act, isn't it? That's why you're looking at 3 times more rate of suicide, and biggest killer in men, and that's why this campaign's out there. And going back to your question, are we doing enough? No, but we are on the right track. There's campaigns out there. There's Calm campaign against living miserably. There's Movember, which is obviously prostate cancer, but now it's going into mental health as well, getting a lot of funding. Prince William's doing a lot of stuff around men's mental health. I think Prince Harry did some as well before he went to the States. So there is getting more traction. There are big people now. Footballers are coming out, rugby players are coming out saying, I've had mental health issues. So more macho men are coming out now saying it's normal.
Yeah, I think that definitely helps. I think the first person that I came across that I was sort of into, because I watched a lot of boxing, was Tyson Fury.
Mm-hmm.
Now, from what I can remember, he was like the world champ, and he kind of had to let his bout go because of anxiety and depression.
Right, yeah.
And that just showed me, because I went through a sort of phase in my life where I was kind of battling sort of anxiety. It really kind of got the better of me at that time. And I think just remember just thinking, because I think, like you said, us as men, we're sort of macho. We're like, this can't affect me. I'm stronger than this. How can these little things affect me so much? And then you I remember watching Tyson Fury talking openly about his mental health, and that kind of made me think, it doesn't really make me weak. It can affect anyone and everyone.
Yeah, exactly.
So what would you say to sort of men out there specifically, if they are going through any sort of mental health issues, or if they are going through some sort of form of depression or anxiety or any other forms, and what would be like your top piece of advice for them?
So my top piece of advice is that don't see it as abnormal. It is perfectly normal. So 1 in 6 people will have mental health issues at any point during the week, and 1 in 4 over a lifetime.
Oh, wow,
and during depression, 20% of adults, 1 in 5, 20% of adults have had some sort of depressive symptoms as well. So it's not abnormal for you to feel down or feel anxious. Mental health, like I said, 1 in 6 people will have it at some point in their life. It's we need to normalize the conversation. We need to destigmatize and get rid of the taboo. It doesn't make you less of a man if you are suffering from mental health issues at all. You will need some help, and the best help I can advise you is speak to your GP. Your GP can then refer you for therapy if that's needed. That could be talking therapy. If it needs a bit more, it could be something called cognitive behavioral therapy. This is all part of a umbrella term called psychotherapy. So it's worth having. For me as a doctor, I was trained to give out drugs like Smarties, but that's something which I'm not against, but it's not my first or second line. It's like my 4th line.
Okay.
Even today, I saw a patient. I tried to take him off antidepressants. He's been on them for 1 year, in March last year till March of this year.
So antidepressants is kind of like it's like a plaster. It's not like the cure for it.
Yeah.
So if you are going through even depression, taking antidepressant is not going to cure you, is it?
No. So it gives you temporary relief, and you have to build them up. With any drug, there are side effects. So you get headaches, you get nausea, you can get shakes and temperatures when you're on them, and you can get even worse side effects when you go off them, especially when you go cold turkey. The most kind of common ones. You kind of use like Prozac, which is fluoxetine, or sertraline, which is in the UK, they belong to a category called SSRI, so selective serotonin reuptake inhibitors.
Okay.
Essentially, they increase the serotonin in your, surrounding your brain, your nerve impulses, which release serotonin. It's a happy chemical, really. So they increase your levels.
Isn't that like a fake sort of chemical? Like, you're forcing your body to sort of have that thing that it's missing out on.
Yeah. So so the way I see it is it's low, but why is it low? So we need to go to the cause. Is it bereavement? Do you need bereavement counselling? Is it job loss? Do you need retraining? Is it emotional abuse? Do you need some kind of therapy? So let's address these therapeutic options. Are you feeling lonely? Are you not eating right? You're not sleeping right? Why is your serotonin level low? Before we top it up, we need to find the root of the cause, because the low serotonin doesn't cause depression. Depression causes low serotonin. Go to why the serotonin is low in the first place. Why is it low? There must be something going on environmentally. Is it childhood abuse you had that's manifesting now? Let's get to the root cause. There's always a root cause, whether it's religious cause, financial cause, environmental. These are the kind of the top 5 causes: environmental, religious, social, emotional, past experiences. Especially for men now, financial is a big cause. Let's get to the bottom of that. So if your financial problems, your lack of employment is causing you to have low serotonin, and that low serotonin has made you then get depressed, we need to get to the to the root issue, as opposed to just topping up your serotonin. Because that's just a quick fix. It's like a plaster.
And then that's only going to last for so long.
Exactly, yeah. You can artificially increase it without necessarily tackling the problem in the first place. So my approach is always holistic. Let's look at your diet. Let's look at your sleeping. Let's look at your relationships. Let's look at your past trauma and abuse. Let's look at how you interact. Let's look at your self-image and how you introspect and how you think about yourself. Your perceived image. If you always think I'm inadequate, that's going to affect your serotonin levels. So your serotonin will go down.
Yeah, because you're going to start believing that, aren't you? If you keep telling yourself I'm not good enough or this, that, and that will affect your serotonin levels. And then we've got to figure out, why do you feel as if you're not good enough, and and that helps with therapy, you're saying.
Absolutely. So it's like reframing. It's like reframing the narrative. Why are you feeling like that? Why are you feeling inadequate? What is the issue? If you're spending 8 hours a day on Instagram, then that's the cause, isn't it? So let's have therapy at that. Let's therapeutically intervene there and stop your have some locks on your phone, have bedtime hour, have blue light filter, all these kind of things, and then let's see your serotonin levels then. Let's just see it then, as opposed to saying you're depressed, therefore your serotonin is low. Let's look at the way around. Serotonin is low because there's a reason behind that. It's suppressed, so therefore let's naturally enhance it. Get more vitamin D, get some more sunlight, speak to your friends, eat better, stop eating processed foods, spend less time on social media, less time watching TV. I
think social media is a big one.
Absolutely, because you compare. The grass is always greener. You're always comparing yourself to other people's life. And that.
I literally find myself, so a lot of my work is around social media. But what happens, I find myself doing this a lot, and I'm trying to stop, is, let's just say, for example, I've DM'd someone. Like when I DM'd you to come onto the podcast, I'll go back just to check, has he replied, have I got a reply, so I can book something in and I can start preparing. But I'll just literally find myself like scrolling,
That's right.
and half an hour's gone, and I'm thinking, I just literally went to do one thing that literally should have taken like a minute max, and half an hour later, I haven't got what.
I tell you what, when Instagram first came out, they didn't have this search function. So when you go to like search someone's name, the search comes up with all the reels and videos. That's when you get lost. And the algorithm, the algorithm knows what you're.
But that's their job, isn't it? Their job is to keep your attention. I think that's one of the reasons why, in your caption, if you were to post, and if you were to post a link, that's not a clickable link. It's just a piece of text. Because if you were to click on that link, you're going to go outside of Instagram. Instagram's job is to keep you there on the platform. But I think that's why now, I think they have got like, you can monitor your usage. And I think Apple itself has kind of got that. I think that helps. But I'm actually trying, literally, I'm trying so hard not to kind of go into that. So even with YouTube, go on one video. But then so doing these things, it releases a sort of endorphin or something.
No, it's dopamine. So dopamine is the motivation, the reward hormone. So you got oxytocin, which is a pleasure hormone, serotonin, which is a happy hormone, and you've got dopamine, which is a pleasure and reward hormone, and even motivation hormone as well. So the motivation, reward, pleasure, for dopamine, and so you get this impulse of dopamine. You get a like, you get a comment, you get a DM, you get this dopamine impulse,
and then you just keep checking back because you want that.
Exactly. And human bodies aren't, they're not wired for that, constant release of dopamine. We're not used to it.
It's like an addiction, isn't it?
Absolutely, it is an addiction. If you look at your kind of prefrontal cortex, the part of the brain, it's like, it is an addiction. It's like sugar, it's like heroin, it's like crack cocaine. It is an addiction, and that's why if you listen to Simon Sinek, who's an American speaker, he talks about this. He said our young minds, especially our teenagers and the millennials, they're not used to this dopamine, instant things, Uber, Just Eat, Instagram.
Yeah.
And that's why it's all blue. Twitter, LinkedIn, Facebook's all blue. Blue light keeps your attention, keeps you awake. Think about it. All of them are blue. That's why you have a blue light.
So from a branding perspective, blue signifies trust.
Cleanness, clinical. It's quite clean, isn't it? Fresh as well. Aqua colour. But from a psychological, if you look at the UV light and how it affects the back of the eye, so the blue lights go straight to the back of the retina. It goes, without being filtered. It doesn't disperse at all. It goes straight back to the retina, and that's what keeps you awake. That's
why they say don't go on your screens and stuff half an hour before bed.
Exactly, because your melatonin and then gets suppressed. Your melatonin is a sleep hormone. So melatonin should peak. It should be peaking now, and even like light now, we've got this light will slowly start depressing our melatonin levels. And caffeine does that as well. So you're supposed to have mood lighting for 90 minutes before you go to bed, so your melatonin rises. But blue light will suppress your melatonin.
I think this stuff needs to be taught in schools because, look, we were brought up with no phones, no nothing. Do you know what I mean? So we kind of slowly got into this whole social media world. So we can still remember what life was like without social. Whereas nowadays, that's all they know. That's all they know. If you ask, the kids nowadays, 9 times out of 10, they want to be a YouTuber now. Do you know what I mean? So that's constantly, if they haven't got an iPhone, they got an iPad or whatever it is. So they're constantly surrounded by all these things. Yeah. Don't you think it should be quite important the fact that how we should monitor this, how it can affect you? Because me just listening to you now and how it can affect you is making me think, okay, look, I need to be careful of this, I need to be careful of that, and just kind of monitor my usage and stuff.
Yeah, exactly. And it's all about it can be good. Social media, like anything, can be good. Food can be good. We need to have food to live. We need to have sleep to live. But if you sleep 15 hours a day, it's not good. If you drink 8 litres of the water, it's not good. You have to have a balance. Social media can be good, like you said, for podcasts, to reach other people, to put out informative content. Even as a doctor, I use Instagram to revise because there were some really good pictures on there, especially in America. You got these surgeons doing these operations, and you could actually learn a lot of medicine from there. Instagram is quite graphic, but you could learn a lot. But then, if you're spending an inordinate amount of time on Instagram, it's not fulfilling its purpose. Fulfilling its purpose, which is for you to give value and for you to receive value. Because then you get to that stage where it's a law of diminishing returns. You've got a value, but then every minute after that, it's no value from that. You've done your DM, you've done your picture or post, or you've done something, but then after, like you said, a half an hour, 29 minutes is wasted, isn't it?
Yeah, literally, it was just that 1 minute was productive, and after that, it was music going down this rabbit hole of but like you said, I think you're spot on with that, because coming from a business perspective, and I've said this before on one of the other podcasts, is where if you're not on social media from a business perspective, you don't really exist. Everyone's on social media. You got to go where the attention is.
Yeah, of course.
So from a marketing perspective, if you're not on social media, or if you're not, if you haven't got a website, or even like TikTok nowadays, TikTok's another big one that's exploding. Yeah, true. If you're not on these platforms, you're letting yourself down. So again, and people have become they've done really well from social media, creating content. People have found their passion through Instagram and all these other platforms. Absolutely. So it's definitely a good thing. But again, it's how we kind of build that discipline to kind of say, okay, look, I've done what I needed to do. Let me put it down a bit. But I think you can only build that discipline if you know what you're doing is kind of excessive, because we don't realize, like you said, even with depression, it's good to kind of get feedback from other people. Am I sleeping? Have you noticed anything different? Even with social media usage, you got to identify, okay, maybe I am using it a bit too much. But I think with the Apple, they've kind of got that thing in place now.
That's right. So even on Android as well, there's applications out there. There's one called Focus, and there's other ones as well which will stop you from using it. So you're not allowed to actually get in the app after like.
That'll put me off getting it then.
Yeah, so you download it's like a firewall.
Yeah,
stops
yeah.
you from actually going on the app.
Okay.
I think Ali Abdaal mentions that in one of his talks as well. Like it stops you from actually opening the app itself. If you spend too much time on it, and then it tells you when to switch it off, when your bedtime it should be, etc., etc. And then it tells you, it gives you this helpful.
It takes you a level of discipline just to even get that though, doesn't it?
Yeah.
Because Ali Abdaal, he's like a productivity guru.
That's right.
Like, he's all about like what makes me laugh about Ali Abdaal was because my little brother, he watches him a lot, and he told me about him, and even my mate, he told me about Ali Abdaal. Very good content, like he's completely smashed it. But there was one point I was thinking, okay, now you're taking the piss, where basically he was basically explaining how you should watch a movie being efficiently.
Right.
Like, times 2, times 3, and then when you see like an interesting part, slow it down. I think that's a bit too excessive. Do you know what I mean? Like, if you're watching a movie, sit back, put your feet up, and just enjoy the moment.
Exactly, because the productivity, then it can become, it's a really good thing I read recently called toxic productivity. Anything can become toxic. So, masculinity, femininity, anything in an excess can be bad. So when you've got toxic productivity as well, stuff like that, and you start speed reading, you're supposed to enjoy a book. You're not supposed to just use everything as a means.
Yeah, because then you're taking the enjoyment aspect out of it, aren't you?
Exactly, because everything. It's like even with food, you're supposed to enjoy food. Otherwise, every day let's just have a drip and that's
exactly.
Like Silicon Valley,
pop a pill.
Yeah. I don't need to eat. I only need to eat just to stay alive. So let me just stay alive, minimum. But food is for enjoyment. Sleep's for enjoyment. Watching TV, Netflix, reading a book, it's for enjoyment. But if you reduce everything to just the benefit you can extract from it, it becomes like transactional. Transactional. It's me give and me take, as opposed to enjoying the moment, living in the moment, enjoying the book, enjoying the food, enjoying the podcast, enjoying the Netflix show, as opposed to speeding it up. Yeah,
it's crazy.
I would never watch movies sped up.
Yeah, I think even my brother, I'm glad my brother kind of like realised, okay, now it's a bit too much.
Yeah.
I don't want to watch, a movie on times 2, times 3, and then
exactly.
when it gets interesting, press play, and then fair play.
It's fair enough doing an audible, because some of the narrators speak very slowly.
Okay, yeah, then that makes sense.
Yeah, so I do a 1.25 or 1.5. 1.5 is the maximum. 1.25 is understandable. But some of the narrators like Stephen Fry, they on Audible, they're very slow and they're like old English professors, so I just double it, like 1.5 it.
Yeah, I do that with so I'll go through a lot of web design tutorials, or so I'm kind of brushing up on my JavaScript program. Yeah. I listened to this one guy, Wes Boss, now because I know the basics and I know what he's talking about, so I kind of put on like 0.5. And I think that's the only time where I'd kind of do something like that. But if I'm watching a movie, I'm literally sitting back.
Yeah, exactly. It's all about escapism, isn't it? We have hard lives anyway. It's all about escaping, and a movie will be an escape for you, or a documentary will be an escape for you. And if you want to be productive, take notes perhaps, but don't speed it up.
So we spoke a little bit about depression. On the flip side, we have anxiety. Now, a lot of the time they're quite interlinked, aren't they? Anxiety can cause depression,
and vice versa.
Yeah. So we spoke a little bit about depression. So what is anxiety?
Yeah, and so just going back to the main point, you can have something called mixed anxiety depressive disorder. So mixed anxiety and depression, and sometimes it can be 60-40, in favor of anxiety. Sometimes it can be 60-40 in favor of depression, and a person can have both conditions. So it's called mixed anxiety and depressive disorder. So I'll just put it out there. Yeah. Anxiety is the most common mental health condition in the UK. In fact, across the world, the most commonly prescribed medication for that is Valium. They call it diazepam. It's
like a muscle relaxer.
Yeah, muscle relaxer for the back pain, etc. Or it's like a sedative, but it's good for anxiety. It stops you from getting the shakes, so relaxes you a bit. So if you're a bit tense, so I think about 1 in 6 people have anxiety in the UK, and about 1 in 6 have anxiety, 1 in 7 have depression. So anxiety is by far the most common kind of mental health problem in the UK. Yeah. So it's much more common than depression. Anxiety can range from being anxious about public speaking. That's not a disorder. That's normal for people to be nervous. About your first podcast, you might have been a bit nervous.
I was kind of like sweating a little bit.
Happens, man. Driving tests, you get nervous.
Yeah, exams and stuff. Yeah.
Even like as a doctor, I see top. I wouldn't say pro, but like semi-pro golfers with a really good handicap coming to have anxiety tablets because they're so nervous before a big tournament.
Oh, really?
Because they could win 5 or 10 grand. It's not a huge amount.
Would that affect their performance though, if they were to
Yeah, so some of it's doping as well, because if you got a shake from your nerves, but if it's affecting you, you've got sweaty palms, you can't really play golf.
Yeah.
So if they're chronically anxious, then you can give them something for that. But yeah, you don't want to get into the doping side of things. So anxiety is very common, and when it becomes a disorder is when, like I said to you before, when it affects your interaction with other people. So
what is anxiety like in its in its finest form? Like, is it the fact that it's being anxious?
Being
the fact
anxious.
that we're overthinking about something, or
exactly.
we're just panicking about what
Absolutely.
if.
So anxiety, anxious is the verb, and anxiety is a noun. So anxiety is actually a thing, and anxious is the doing of that thing. So it's be feeling jittery, feeling nervous. Nervous is fine, but when you get chronically nervous, like
when it's affecting your day to day,
exactly. So you're scared to go outside, or you're scared to go shopping, or you're scared to drive the car, or scared to go in the shower because you might drown. These kind of things, then it gets to almost a disorder. So an anxiety. So you've got something called GAD, so generalized anxiety disorder, where you're generally a jittery, bit more on edge kind of person, and that can affect your interactions. You can be very anxious about so many things as well.
Absolutely everything.
Yeah, exactly. And then that can go into sometimes delusions. It can go into OCD as well. It can go into some kind of mania. So anxiety is a spectrum. So you've got generalized anxiety disorder. You got agoraphobia, which is fear of kind of open spaces, market spaces, that kind of stuff.
Is a phobia like a form of anxiety? So any type of phobia?
Yeah, so
or is that something
it's
else?
on the spectrum, isn't it?
Okay.
So a phobia, yes. So if you've got like arachnophobia, which is phobia of spiders, you're highly anxious around spiders. Your heart rate goes up, you get sweaty, you get all these symptoms of anxiety around spiders. So yeah, so a phobia is on the spectrum of anxiety, but the most common mental health disorder in the UK is anxiety, particularly generalized anxiety disorder. Some people have social anxiety, some people have relationship anxiety, some people have all sorts of public speaking anxiety. So you can take stuff for that, but the best treatment I found anyway, someone who's had anxiety and someone who's treated literally hundreds of patients with anxiety, is kind of cognitive behavioral therapy. So actually reframing the way you think about things. So why are you scared of spider? Why are you scared of this? Reframing your narrative and actually unlearning what you've learned, and then changing your mindset, and then actually going forward with your life. Because then it can affect your life. If you're a anxious person, driving will be hard. Going to the toilet will be hard. Ordering at the restaurant.
Even the slightest little thing, getting out of bed will be hard. Yeah,
absolutely. So because life is unpredictable. 99% of life is, what happens to you. 1% is planned. 99% is just what happens.
Because I think when you're anxious, or if you are going through some form of anxiety, it's hard to be present.
Yeah.
It's hard to kind of enjoy the little things, like because like I said, I went through a phase in my life where I was going through quite an anxious moment in my life, where I was just used to find it difficult just to kind of appreciate where I'm at. Even if I've achieved something, I wouldn't be able to fully kind of embrace it. Like I wasn't happy the way I should have been. So I know a lot of guys out there, because I remember when I was going through, I was thinking, I'm strong, man, I can get through this. But then getting help and stuff kind of made it better. What would you kind of give the advice, if someone is going through some sort of form of anxiety, or maybe they're not understanding what's going on, and maybe they are panicking and stuff? What would be your go-to? What would you tell them? What would be the first thing they would need to do to kind of get that help that they need?
Yeah. So with anxiety, you can get something called a panic disorder. Is when you start panicking. That's like an anxiety crisis. It's like an anxiety attack. We call it a panic attack.
Okay.
But the medical term is panic disorder. So that's on the spectrum again of anxiety. The first thing I say is, if you're the kind of person that likes formal diagnosis, then you go to your GP. Once you've got a diagnosis of anxiety, of phobia, of panic disorder, then you can start treating. So the treatment's not that difficult once you know the diagnosis. But a lot of people are living in limbo where they don't know what's going on with them. And they're just kind of putting this mask on, saying, nothing's up with them, but something is going on. So once you got the diagnosis, whatever that may be, depression, phobia, mania, whatever, you get the diagnosis, and then the treatment will be much easier once you know what's going on. So speak to your GP, get referred to a therapist if you feel like it is impacting your life. But if you don't want to get to that stage, there's all sorts of charities out there, Mind, MIND.
Oh yeah.
Mental Health Foundation. There's Samaritans. There's so many charities out there. There's Calm, campaigning against living miserably. They've got exercises, breathing exercises for anxiety. They've got stuff about your mood. They've got basic, common sense kind of approaches to tackling a lot of lower level mental health problems. But if it's more than that, then you go to see a GP. Then you might need psychotherapy, which is graded exposure therapy, cognitive behavioral therapy, where you talk about your experiences. You change your mindset going forward, and then the last one, if you ever get to that stage, is kind of tablets for anxiety, tablets for depression, phobia, mania, etc. So there are tablets as a last resort. But I think before that, 90% of stuff can be treated without tablets. And I'm a big fan of getting treated without tablets, because tablets have addiction problems, they have side effects, they make you reliant on them. If you're driving, you got to be careful. If you're picking up a baby, you're going to shower, you got to be careful of certain antidepressants as well. So there's so many side effects with tablets, because you're messing with normal physiology, which is human brain. You're messing with the transmitters in the brain. You're messing with hormones. So it's better to modify them through therapy.
Yeah.
Normal one-to-one. Even like this, we could see this as a form of therapy. Speak to someone who's on your level. Yeah. You can do it via phone. You can do it via your Zoom and Skype. Therapies are available now. And if you feel like you need help, so always go to see a GP, check the websites out. I think in your video, when you put it on, just put links to the websites. That'll be really good for people. No,
I'll definitely put the links in the description. If anyone wants to reach out to any of these charities or anything, any more information, we'll definitely put the information in the description. There were a few questions from Instagram. Let me just get that up. That we wanted to sort of ask you in regards to mental health. So, first question is, how do you keep yourself in check? So, from never suffering to experiencing it again, and will it ever stop?
So, if you never experience any mental health, you're probably very lucky or very rare, because everyone does at some point, whether that's anxiety, low mood, bereavement, whatever, phobia. We all go through it, and at any one point in time, almost like 1/6 of us are going through it at this time. At any one point in time. So 1/6 of people, it's quite significant, isn't it? It's quite
of course.
It's a big chunk of the population. So from never experiencing it, I think having a good support network, building your diet, building your nutrition, sleep, having a good, healthy lifestyle will make you less likely to have it. Having good support network, having good, being close to your family, being close to your friends. So if it ever does occur, you've got people to vouch for you and people to kind of pick you up. You need that support network. So build your armor strong. Like a king will build his castle. Castle, and then outside the castle is the fort. So you've got to, you fortify the fortress. Just sleep, nutrition, that kind of stuff. Look after yourself. Be in good shape. Meditate if you can. So that's preventative, isn't it? So just like you prevent yourself from having diabetes by being fit, or prevent yourself from having asthma or these kind of things by not smoking, prevent yourself from getting any mental health problems by having a strong guard against it. And if you do get it, like I said, what I mentioned, the therapies out there, psychotherapy is probably, like, for me, is preferred over medication. Psychotherapy is really good. So that's a good first mode of treatment. And then if you do get it and you get better, there's a chance you might relapse. But with the relapse, always make sure it's not as bad as the first time around. So have support in place. Know when to seek help.
I think that's a big thing.
They say about 60% of men will only seek help when they get to crisis point. So they get to the crisis point. 60%. It should be much less than that. Men should seek help. Quite quickly, as opposed to letting it get to crisis point.
I've noticed that a lot of these celebrities or these high-end, people in their careers, they have a therapist with them a lot of the time, or they have regular therapy sessions, and it's just to kind of keep them on track, just to kind of, to make sure that they're not too far gone, or like you said, wait until that crisis moment happens where it's like, oh my God, I don't know what's happening.
Yeah, exactly. So having regular kind of checkups with a therapist, can help. Not waiting for something to get so bad where you get to crisis point, because when you get to crisis point, you're so out of it. You only just want to kill yourself. Let's get before that and tackle it before that. Reach out to the charities, reach out to your GP, speak to friends. Lockdown has been difficult for a lot of people. Like I say, 1 in 5 people have been experiencing some sort of depressive symptom. That's 20%. In some sort of depressive symptom. So whether that's low mood, no energy, sleeping too little, too much, or not eating properly, or just generally not having pleasure in your life activities, that's been a hallmark of lockdown.
I think what helped me to kind of overcome sort of the anxiety that I was going through was just one, understanding that everyone has anxiety. I've been told it's kind of like it's a thing that keeps us protected. It's like that defense as humans. If something happens, we jump in, and that's a little bit of anxiety. Like it's there to protect us. But again, obviously, they come to a point where it kind of affects your day to day and things like that. And also, I remember when I was going through it, and I was thinking, I just wanted something to kind of make it go away.
Like a magic wand.
Yeah, just like take this and it will go away, or like a magic wand. And I think it's understanding it's not something that you need to get rid of. Yeah. It's something that you need to be able to manage and build these tools mentally to kind of help you to kind of manage these things and you sort of manage your expectations. So if you find yourself overthinking or stressing about falling or drowning in the shower, like the example that you gave, it's acknowledging that this is where your anxiety is kind of taking over, acknowledging those thoughts, cool, and don't sort of engage with it, don't kind of feed into it, and just and then what happens is it'll kind of lessen and lessen.
Yeah. And also, like, people meditate now. It's been very trendy to meditate, but back 15 years ago when I was at medical school, we used to teach all of our anxiety patients to not meditate but deep breathe. So diaphragmatic breathing. So put your hands on your diaphragm and nice deep breaths, and that stimulates your vagus nerve, which will calm you down. Okay. And also having that recognition that I've got this irrational anxiety about something. Let me kind of take myself away from the situation, and that's called metacognition, where you actually think about thinking. So you're thinking about thinking. You understand? And that thinking you have is wrong. So the anxiety provoking thought, it's wrong, but you're thinking about So you take yourself out of that situation. Okay. And say, look, just kind of float like a ghost and say, look, this is me. I'm scared of this thing.
Should I really be scared?
Yeah, exactly.
Is there an actual threat?
Exactly.
Logic from a logical point of view, thinking.
Exactly. Okay. Yeah. So you just kind of write on a blackboard, and that's what therapy does for you. They help you write on a blackboard, and they help you reframe it. So next time it happens, you say, oh, actually, I'm scared of something which is so minuscule. Yeah. You know what I mean? And you don't get caught up in it. And deep breathing has been really good. And even for me, it's helped me a lot. Deep breathing has been really good because we get in trauma situations, we get in very it's difficult. It's I can imagine. It's like lots of people coming in hospital, and you have to keep calm. And anxiety, it's easy to get anxious. It's easy to get burnt out. And I've seen colleagues burn out as doctors of PTSD from COVID. They're burnt out. They got anxious as well because it's just relentless in COVID. It's really hard. So having the anxiety controlling kind of techniques such as diaphragmatic breathing, it's helped me with my speech as well because I've got a stammer and it has been quite bad, but I know that when I put my hands on my diaphragm, like even in the Dragon's Den, you might see me with my hands on my stomach.
Oh, so you've experienced a form of like anxiety and stuff like that yourself?
Yeah, so I think mine was I think stammering, it's a speech impediment which I've had therapy for in the past.
Who else? What's that guy's name? He had one.
Singer.
No, what's that guy?
Gareth Gates.
Gareth Gates. So he was able to sing mad.
Singing for me, look, if I do public speech, it's fine. Like I can memorize it. You know what I mean. But when it comes to like off the cuff talking, I do like 90% of the time I'm okay, but 10% I do stumble.
You've been, I couldn't tell to be honest.
But there's a few things like but there's quite a few. Like Bruce Willis has got one. Morgan Freeman, Mr. Bean.
That guy's on talk show. Very popular.
Steve Harvey.
Steve Harvey's
got one. Yeah, Joe Biden.
He had one. He had a very bad one. Yeah. He hasn't now because he's overcome it and he's done. But I remember I was watching one of his programs and he was mentioning it that he had a speech impediment. Like people used to really struggle to talk.
Severely.
Yeah, you couldn't really get your words out properly. And
so even at college, like I remember, I phoned my friend once, Haroon. I phoned him. It took me 30 seconds to say my name, honestly. Because that was... So anxiety makes my speech impediment worse, and then speech impediment makes my anxiety worse. It's like
it's like a cycle,
it's a vicious negative cycle. But now, because of the anxiety techniques, which, the listeners should definitely take on board, it's helped me with my anxiety, then it's helped me with my speech impediment. And it's actually a positive cycle now, not a negative cycle. Wow. And, a lot of it is breathing. Because, as a doctor, I can tell you, if you breathe deeply from your, not from there, not from your throat, not from your chest, but from your diaphragm. If you look at any baby, 2-year-old child, they breathe with their diaphragm. Always breathe with their diaphragm. You know, adults, we forget how to breathe properly. You know, breathing should be from the diaphragm. So if you unlearn the bad habit of breathing from your chest, and then relearn the natural...
Get my belly out right now.
Strengthen the core, breathe from your diaphragm, put your hands there, and even at night time, you know, when you're on bed, trying to lift the duvet with your belly.
I can usually do that anyway.
So do that, you know, it strengthens your diaphragm, and it's good, and you get more air in, you can breathe more air out.
Oh, that's interesting. You know, mental health is one of those topics we could literally sit here for hours and hours and hours, and we still wouldn't even touch like a,
Absolutely.
you know...
It's like a tip of the iceberg now.
Yeah.
You know, because COVID is the real pandemic's mental health.
Mm.
You know, COVID...
I agree.
You know, yeah. COVID, like, I can tell you it's getting better now. I've been vaccinated, you know, a lot of my colleagues, but in fact everyone today on the ward got vaccinated. Like, COVID rates are going down now, like, you know...
Do you think we're coming out then? Can we see the light at the end of the tunnel?
Yeah, of course. Like, you know, like, hopefully...
I can't wait, man.
Fingers crossed, you know, this year will back to normal, but mental health's the real one, isn't it? Mental health that is the pandemic that's going to follow.
I think, again, I mentioned in this one of my other podcasts is gyms was a big one because a lot of people used to go to the gym, and it helps you physically, but it also helps you mentally, doesn't it? Yeah. It's kind of one of those where you kind of just let it all out. Yeah. It's the time where you take for yourself. Mm. And when I go to the gym, I know I feel so good mentally, and it just used to feel really amazing. It's
a huge help because, you know, endorphins, they are like pleasure hormones. Endorphin and morphine, they've got the same root word. So it's really good. Very good for your brain, you know.
I really appreciate your time. So we are coming at the end of the podcast now. If people want to reach out to you, or if they want to ask you any questions regarding mental health or anything like that, how can they reach out to you?
Follow me on social media, Dr. Asif Official. DrAsifMunaf.com is the website. So, you know, happy to answer any questions, particularly around mental health. No medical questions, please, just mental health. Otherwise, I get aunties asking me about their...
My daughter's doing this.
So, mental health, happy to help. And it's something I'm passionate about, and it's something I want to give back to the community. So, absolutely, reach out to me. You know, DrAsifMunaf.com, Dr. Asif Official on Instagram, Twitter.
Thank you. And guys, if you want more information on the charities that we discussed, we'll definitely put the links in the description below. Again, thank you for your time.
Thank you for having me.
On to the next one, people.